Smiling is infectious, yes it's true. Please be careful or you'll catch it like the flu.
I'm Dr. Kenneth Levine, and welcome back to the last segment of Health Talk for this evening. We're going to talk more with Dr. Dean Fishman. You know, Dean, I have 7 grandchildren, and every one of them has a handheld device. I'm concerned about, first of all, the lack of sociability that they have, but you have developed a modality on the cell phone to help patients with their posture and future disease. You want to talk about that?
Sure. Well, what you're talking about, aside of the lack of social ability, is the constant poor posture of being forward over this device, playing their games, texting, emailing, or browsing. This is the common posture that we see on our streets. And what had happened is I put the pieces of these puzzle together several years ago, and I was one of the first ones to come out with it, and I called the condition, which is now known globally as text neck. What's happening is our head weighs approximately 10 pounds. When we tilt our head forward, we're now increasing the weight of our head onto our spine by 100% for every 1 inch that we go forward. So if our head weighs 10 pounds in neutral, 1 inch forward is now 20 pounds, 30 pounds, 40 pounds. When our head goes forward, our shoulders roll, our chest sinks in. And kids nowadays are on these devices for what has been counted to be 7 hours and 45 minutes per day, the average American teen.
Wow.
And so they're in this posture for long periods of time. Earlier we were talking about repetitive stress. This is creating an early onset of arthritis into our young in their necks. So this text neck problem is really a global epidemic. What we did in our office is we found that chiropractic adjustments help. Exercise helps. Stretching helps. But the biggest change really came with breaking that habit of looking down at your device.
So show us how this works.
So what we did is we created an app for the Android devices that puts a green indicator light in the top corner of your phone when you're holding the device with proper posture. As you start to lower your head, the green indicator turns red and you can hear a beep. You can also put in a vibration if you like. And it reminds you to pick your head up and break that habit.
Now, you talked about arthritic changes. How young can this be seen?
Well, as you mentioned your youngest patient in your practice, my youngest patient was 3, whose parent brought her to me for headaches, and every time she would come in, she was carrying her iTouch and playing an alphabet game.
Right.
This is how kids are learning now on these mobile devices. I love technology. I just want to use it correctly. So I'm not saying that she has arthritis at 3 years old, but she certainly has symptoms, and she's on the path to get this arthritis at a much younger age.
In your practice, what is the youngest person you've seen who has arthritic changes?
We have postural changes in the teens.
Right.
We have bony changes in the 20s.
Wow, that's significant. Because today, as I mentioned before, people have to live to their 100s, so they got bony changes starting in their 20s. They got 80 years of discomfort and debilitating posture and changes in pain and horrible things happening for a long time.
I challenge you to go to an Apple store, airport, restaurant, grocery store, red light, and look for somebody who does not have the text neck posture when they're looking at their phone.
Sure. You know, in our family life, I try to have my grandchildren come to dinner without their devices because I'd like to have conversations with them, and we sort of have a rule that no devices at dinner. And it's nice because we're able to talk, we're able to converse, we're able to have that person-to-person contact. But I think the easy way out for parents and grandparents is to let the kids play on the games and not have conversations.
Absolutely. You know, there's a statistic that says more people in the world have a mobile device than have a toothbrush.
Well, that's not good.
Or I should say, use a mobile device than use a toothbrush.
That's terrible.
Well, think about it. These young kids, these little ones, we're being babysat by the iPad.
Right.
And they're watching YouTube or Mickey Mouse or SpongeBob on these devices, and they don't have teeth, and they're chewing on their devices. They're not using a toothbrush yet, but more people are using a device than they're using a toothbrush.
Well, I got to tell you, I want them to get toothbrushes. This is Dr. Kenneth Levine. We're in Health Talk. You can visit my office in Tamarack, Fort Lauderdale. You can visit us for no charge for exams, consults, and radiographs. Visit us on the web at www.drklevine.com. I look forward to seeing you soon. Thank you.
Smile, though your heart is aching. Smile, even though it's breaking. When there are clouds in the sky, you'll get by.